Tomasi, why are you not in school?
I was sent to get money.
Money for what?
Dr. Washington told me if I wanted to get well, I have to pay for the medicine he gave me.
Are you sick?
Hey, how can you let Washington give him medicine? He's not a proper doctor.
But if Tomasi needs medicine, it is cheaper to get it from Washington. The health center charges so much just to go and visit it.
Wacha uongo. That is not true. The prices have been greatly reduced since 2004. It is now 10 shilling at the dispensary and 20 at the health center.
Sometimes you pay and you don't get any treatment or any medicine. How fair is that?
The new system is much better than the older one. It used to be expensive and I used to buy everything on credit.
It is not any better, eh? Right now, the line is so long. You sit there the whole day and sometimes you don't get seen. They're out of staff and sometimes they run out of trucks.
So now if there was enough medicine and there were nurses and doctors, things could be sour. Sidio?
Yes, but it still has to be free in hospitals too.
Okay, I'm going to write that in my manifesto. But for now, let us go and find out what this Washington is all about. Giving medicine when he's not even a doctor. It is very bad. Let's go. Do you, Margaret, just take care of the store. Let me see to this.
Mr. Washington, my name is Pendo Modulo. I'm the new headmistress.
Yes, thank you. Washington.
Are you feeling all right, Mr. Washington?
Yes, I'm quite fine.
He is a fake.
What?
He is not a doctor. He doesn't have certificates, yet he's giving children medicine. Like Thomas here.
A doctor? What's going on here? Who are these women?
Mama Boga. Thomas here has the symptoms of a very bad cough, which I've already treated by giving him cough medicine.
Medicine? Have you been giving children medicine?
It's perfectly all right. I'm medically qualified. I have my certificates. In fact, I'm just helping these children. If you doubt my judgment, we can just go and ask Dr. Charles.
That is exactly where we're going. Go there.
I think we better go to Mr. Washington.
Where is the doctor?
He's seeing a patient.
Now we need to see him. Does this boy look in for you?
I said he's busy, and there are many people before you.
My son could be dying and you're doing nothing.
He's not dying, he just has a cough.
Look, nurse, I can see this hospital is in a chaotic mess, but surely there must be a doctor who can look at this boy.
Chaotic mess? That's who do you think you are to come in here and...
You see, I gave the child some cough medicine.
And that is when Tomasi came to ask me for money for his medicine.
I'm sorry to say this, Washington, but treating children when you're not a doctor is wrong and can be dangerous. A child with persistent cough can be seriously ill and needs to be tested. By listening to Thomas' chest and cough, it's very likely that he has tuberculosis.
You mean Tomasi could be really sick?
Don't worry, Anna. If Thomas has tuberculosis, as I suspect, we can cure him. But he needs to be treated properly and with specific medicines. Cough medicine, over-the-counter, and traditional medicines cannot cure TB. And TB, if untreated, can kill. I need to take Thomas for sputum test immediately.
But, Daktari, I can't afford for those tests.
The smear examination is free to anyone suspected of having TB. And TB treatment is free in all government health centers, so don't worry. I need to take Thomas for the test now. We should have the results in the next 24 hours.
And while I'm here, I can do the research and find out from my people what they want with their Medicare.
Right. Thomas is having his test now. We won't have long to wait. Now, Anna, I want you to bring your family to the health center for tests. TB is contagious, and it's very easy to catch, especially if you live with somebody who has it. It's for you, Bishop Washington. Treating children is wrong, and you definitely should not be charging them for treatment when they can get it here free of charge.
You see, doctor, the sick bay is for sick children, and I'm the only qualified teacher who can treat them effectively.
Then you must be aware of the early symptoms of TB and the consequences of delaying in seeking diagnosis at a recommended health center. Treating children here and charging for them is wrong when they can get it here free of charge.
Aye, but it's not free. I mean, I have to pay 20 shillings just for coming here today. So how is that free?
The 20 shillings for registration is free for children under the age of 5.
And you won't have to pay for anything today. I mean, Mr. Washington will cover it for causing you so much worry.
Oh,
Is that really necessary, Principal Mwadulo?
principal?
Yes, I'm the new headmistress.
I hope you're taking better care of your students than you did Thomas.